The honourable member from Tyne Valley-Sherbrooke.
We all wish the pandemic was behind us, but wishing that something is true doesn't make it so. Earlier this sitting, my colleague, the member from Charlottetown Belvedere, passed a motion that highlighted emerging evidence around long COVID. The extent and prevalence of long COVID will have far-reaching impacts for individuals, our economy, and society. However, this is not the only factor we need to consider as we work to build back better and ensure our economy can thrive and that all islanders can live healthy and well. A previous infection of COVID-19 doesn't necessarily prevent someone from contracting the virus again, even with the same variant. In fact, reinfections might be quite common, is what we're seeing, particularly between subvariants such as Omicron and the new Omicron BA.2 strain. The good news is that reinfections are more likely than the first infection to be mild, and being fully vaccinated with boosters improves the likelihood that milder and shorter symptoms will occur. However, mild illness generally still consists of symptoms such as runny nose, cough, sore throat, and headaches that span through several days. Those reinfected will still need to take time off to get better and to avoid spreading the illness to others, particularly to our most vulnerable. We can't forget about them. In addition to the risks of reinfection, the ever-present elephant in the room is the possibility for more variants. In fact, we know that there are already new variants emerging. Vaccine inequity across the globe means that the risk of new variants forming is greater in some parts of the world, and as we know, variants can inevitably spread everywhere, especially as governments reduce public health measures. While we can't possibly know what new variants might look like and the impact they may have, effective planning means we must not ignore this very real potential. All of these factors mean that COVID will still be with us in some form for years to come. We must consider what measures can be maintained or put in place to protect vulnerable islanders and allow our economy to move forward in a safe and responsible way, such as continuing access to testing, wearing masks in indoor spaces, providing paid sick days for all workers, and improving ventilation and ventilation standards. Learning to live with COVID should mean fewer islanders are getting sick, not more. Thank you, Mr. Speaker.